And, that whole time, and I know this is something that you talk about, and I've talked with plenty of other plastic surgeons about, we were always taught in residency and fellowship, and I trained at top established institutions across the U.S., implants are safe, right? And what ended up happening in my career was around 2017, I started seeing patients with breast implant illness and in large volume. I invited, I think, like all the Illinois plastic surgeons where I was practicing, and I was the only one that showed up to talk about breast implant illness. And at that point, I had, done all the research. I understood, the problem with BII, and I just continued to kind of go down that rabbit hole of, what is breast implant illness? All the same questions I'm sure you've asked yourself over the years. And as you start doing the explant surgeries, for me in high volume in 2018, it was like patient after patient are getting better, like Miraculous Recoveries, turnarounds. I don't need to tell you about that or anybody else that does explants in any kind of large volume. And at that point, this was around 2019, 2020, I was like, I'm just not putting implants in anymore. Like, I understand informed consent, but I mean, I just can't justify putting these foreign bodies in patients, knowing that, even with appropriate disclosure, they have this chance of going on to getting something that could really be pretty detrimental to their life and to their health.